Mulapiru Vagai.
How far has electric mobility developed in Sri Lanka and worldwide?
Right, a battery technology that's going to change the world. So when we design something for Sri Lanka, we have to be very mindful of that. It needs to look good.
What are the real mobility challenges that we are facing as a nation?
Is there an effective way to make sure that people can move from point A to point B simply and inclusively? That's it.
Bicycles, it's an accepted, common, normal way of transport.
Cycling has been pushed towards a poor man's transport.
Do you think that we have a proper government policy to encourage electric mobility in Sri Lanka?
It's not government policy first, it's people policy first. People set the trend, everybody else follows.
Business in conversation with Yas Fazul this Saturday at 5 p.m.
COVID-19 සඳහා ආරක්ෂිත පියවර. නිතරම හොඳින් සබන් යොදා දෑත් සෝදන්න. සබන් හෝ විසබීජනාශක මධ්‍යසාරයක් භාවිතා කර දෑත් පිරිසිදු කරන්න. සැම විටම අන් අය සමග මීටරයක දුරස්ථභාවයක් පවත්වා ගන්න. හැකි සෑම විටම නිවසේ රැඳී සිටින්න. නිරතුරුවම නිවැරදිව මුඛාවරණ පළඳින්න.
තනිව යන්න බෑයි කියන කාරණේද අධ්‍යාපනයේදී මම කියන්නේ ප්‍රධාන වශයෙන් සිදුවෙන දේ.
අපිට රුසියානු සපත්තුව මේ ලංකාවට දාන්න බෑ ඒක ලොකුයි. චීන සපත්තුව සීන සමාජවාදී ඒකත් හරියන්නේ නැහැ. ඒක මේ කකුලට පොඩි. අපි අපේම සපත්තුව මහ ගන්න ඕනේ කියලා.
එක්සත් ජාතීන්ගේ මානව හිමිකම් කවුන්සිලය කියලා කියන්නේ මානව හිමිකම් පිළිබඳව ලෝක පාර්ලිමේන්තුව.
අපි පරිසරය ගැන දෙකක් තිබුණා. මම ඉස්කෝලේ යන කාලෙත් මේක තුන්වන ලෝකේ රටක්.
News First, Newsline with Faraz Shaukatali.
And a very good evening to you and a warm welcome to Newsline Live. My guest this evening is the Secretary General of APAC, and we'll tell you what APAC stands for soon. He is also the immediate past president of the Sri Lanka Medical Association, none other than Professor Indika Karunathilake, no stranger to our program. Very good evening and welcome to the program.
Very good evening to you.
And what is APAC? Can you tell us quickly?
Yes, actually, APAC is one of the largest public health organizations in this region,
right.
Representing about 50 countries in this region and over 70 institutions, public health related institutions in the region. So that's one of the leading and very powerful public health organization,
right.
And has a lot of role related to the current pandemic situation.
And what's the real story about the pandemic CV-19 as we speak? How's it doing?
Yes, I mean, if you compare with the situation that was 3 months ago, maybe 4 months ago, yes, the number of patients or the cases have come down, and also the number of deaths also come down. Still, I think we see some reasons for concern. For example, the number of patients reported maybe stabilized around 700. So it's not going down anymore. And similarly, the number of deaths as well, around 30s every day. So what we would like to see is actually that the reduction that we have seen during last 3 months to continue, but it's not happening. So that's the reason.
Why is that?
Yeah, so that means probably the infection is spreading again. That we see in the services that we provide.
Do you have any proof?
Yes, there's a lot of proof from the clinical, the hospital sector, and also the patient support helpline services that we conduct through the 247 and 1904 from SLMA, Ministry of Health, and the COVID-19 National Prevention Center, all these collaborative activities.
And what about the bed situation?
Now if you take the number of patients, that number of maybe calls that are coming to helplines or even to the admission to the hospitals, we see a lot of patients within the same household getting infected. So that means the household spread that was there 3 months ago again has restarted. And similarly in places like schools also, and other officers' schools, we again see reports. And you ask a very important question regarding the bed situation. Gradually the number of vacant beds coming down, and most importantly, one thing we need to note is the number of patients admitted with comorbid conditions are on the increase.
That means people with underlying other health issues.
Very much important, because those are the patients who might go into complications. And at the moment, if you take the ICU situation, the ICU beds that are allocated to COVID patients, again almost 96% full. So these are reasons for concern, I think. So I think everyone need to take responsibility.
So we can't just be complacent.
Definitely not. Definitely not.
Okay, having said that, you know, Sri Lankans are very fun-loving people. I'm sure you are too. So what should we do at Christmas?
Yeah,
There's a big season coming now.
I suppose everyone should basically adapt it to the new normal situation. And
what's that? Gloves, I mean, washing your hands?
Yes, I mean the basic preventive measures, the physical distancing, hygiene, and wearing masks, so on and so forth. All these things obviously we need to adhere to. And in addition to that, now you mentioned about the festive season. So there are also the most important factor that leads to spread is actually the conditions where a lot of people are in a congested environment. So that's where that.
Do you remember we saw all those photographs during the Sinhalese Tamil New Year from Maragam and Pamana Road and all that?
Yeah. So that is what we want to avoid. So maybe if, I mean, at the same time people would want to enjoy the festive season, so on and so forth. So maybe with some kind of forward planning, say maybe start in the shopping early on, avoiding crowded places.
Listen, you can't have the government to start doing all this, because there's a certain element of responsibility by the citizens too.
I suppose all of us, government and the law enforcement and citizens, all of us have the responsibility.
Yes, but we can't expect the government to sort of be nannies.
Not only government. All of us have the responsibility.
And do you think this idea, the police recently said that we want people traveling in the cars, unless they are related to each other, then they must wear the mask. Do you think that's a good idea?
It is actually a good idea. It's actually a good idea, yeah. So, because, I mean...
It's not sort of, they're not kind of being overly panicky, are they?
Not really, because if you take the environment within a car, and if there are few people within the car, it's been a confined environment, especially the air conditioning, so the risk is there actually.
It is there.
It is there. I mean, we have to take all the precautions. Now, this situation also, I mean, we are not wearing masks because of the audio-visual requirement, but yes.
But yes, and also we're well, we've kept our distance.
Yeah, so every time, I mean, that is a must, I think.
Yes. All right. So, what are we doing wrong, if we are doing anything wrong, in trying to get these figures down? 30 deaths a day is 30 deaths too many.
Yeah, I mean, even a single preventable death is unacceptable.
Indeed.
So, yes, yeah.
So what can we do? How can we get it down?
I mean, getting back to the basics, I suppose. Getting back to the basics. So, I mean, country can't be on the lockdown situation forever. But like we mentioned previously, everyone has a responsibility. So, I mean, we have the responsibility to avoid crowded situations unless essential.
Would you welcome a situation where the public, let's say they're going into the railway station or they're going into the bus station trying to get a ticket to get on the bus? Would it be a good idea for it to be a legal requirement to have your vaccination card with you?
There are pros and cons. One way, it would encourage vaccination, and there's clear evidence to say that vaccination has basically led to the reduction of morbidity, then the cases and the severity of the disease and the mortality. At the same time, one thing we should not forget is vaccine will not prevent you getting the disease.
No, but it will increase your chances of surviving.
Exactly, it will increase. So you have to get the vaccine, you have to encourage the vaccine. And so legal enforcement, there are both this. There can be advantages, there can be disadvantages.
And thank you very much for your questions. Coming up on the screen is the number by SMS or WhatsApp, whichever is your fancy, 0772 300 305. 0772 300 305. And here's one, and it is marked urgent, and I'll take it because it is the question is actually quite sensible and urgent. How long after the second dose should senior citizens take the booster? Some say 3 months and other doctors say 6 months. What's the real story?
Okay. So here, generally what the idea of booster dose is when the immunity of the second dose goes down, goes down to a certain level, then after a third dose it can go up. So that's the whole idea. So it should not be too early, it should not be too late also.
Right.
Yeah, when it...
So where's the medium?
Where is the medium? It's a very interesting question. Now, if you take certain vaccines, like AstraZeneca, research has shown that it will last for quite some time. Sometimes it can be up to 6 months or so. Yeah. So in that case, it would be a good idea to take the booster after 6 months in that case. If you take Sinopharm, again, the current data says it could be around 3 months. So in that case, it could be better to have it 3 months. But having said that, what the Ministry of Health is doing is a program.
Right.
So Ministry of Health, because of the program nature, rather than going for individual vaccines, they have gone for recommendations. So I suppose we have to go by the recommendations that are issued by the Ministry of Health. According to the Ministry of Health guidelines, regardless of the vaccine, the guidelines clearly says, regardless of the vaccine, it should be minimum,
regardless of the type of vaccine?
The type of the vaccine. Regardless of the type of the vaccine, it has to be minimum 3 months.
Minimum 3 months.
Minimum 3 months. Minimum 3 months. So it can be later than 3 months, but minimum 3 months.
Okay.
It should be after 3 months.
Right. So you don't go and burden the system by going inside 3 months. That's what you mean.
Yeah, because it won't have any impact also, no?
Right.
Because to boost, you have
need to boost something.
You have to boost something. I mean, if your immunity is already there, there's nothing to boost.
Right. Now then, we've got about 5 minutes before we come into our break, in which we'll look at the primetime headlines. But in the meantime, what's the real story with this, how do you say it?
Yeah.
Omicron?
Omicron. Yes. Yeah.
Omicron?
Yes. Okay, so it's the new variant that has been identified in South Africa.
Right.
Yeah. So it's nowadays the viruses are named according to WHO classification. They are named according to the Greek alphabet. So the Omicron is the name that denotes the letter O. So that's how it is named. Previously also. Initially the classification was very complex, and later they were named after the country it was discovered. But all these are basically now abandoned, and now WHO is focusing on naming the vaccines according to the Greek alphabet, which is somewhat neutral in that case. Yeah. So this has been identified or detected in South Africa. It doesn't mean that it originated from South Africa, but it was detected by South African scientists. Most probably it originated in Africa. And the nature of the RNA viruses, viruses like coronavirus belong to the RNA virus category according to genetic material. By nature, they are very much prone to mutations or changes. And it depends on the circumstances or the environment they face. And some of those mutations can lead to variants, that may not be that harmful. So they are called variants of interest.
Right.
There may be possibility, but some might have serious concern. So those variants are named by WHO as variants of concern. So this mutation or this variant named Omicron is named as a variant of concern by WHO. The reason is the mutation that has happened within the genetic material belong to the areas that produce the proteins that are mainly responsible for the spread of the disease, and also might have some implication on the vaccine activity. For example, if you could remember the electron microscope structure of this RNA coronavirus, you may remember those spike proteins jutting out. Those spike proteins are the ones that are responsible in binding into the human cells and entering. And also, that's basically the target identified by all the vaccines. To attack for the immune system to attack the virus. Therefore, any change that would lead to the production of what called the S gene that lead into the spike protein production might have some implications on the spread.
Right.
Yeah. So that is why, because when there are changes in that protein, and when there are changes in the gene that is responsible in producing that protein, it might have an impact on the spread of the vaccine, and also the spread of the virus, and also the severity of the disease, and also the impact on the vaccine efficacy. So there's a possibility.
There's always a possibility.
There's a possibility. There's
right.
a possibility.
Thank you for all your questions. It's getting, once somebody's saying it's getting a little bit too technical, we'll try and break it down and make it simpler, shall we? But we'll do that after this evening's headline news. And it's bound to be an interesting news tonight, because we had all sorts of things happening, gas explosions and the gas results and so on, and of course the release of Mr. Azad Saleh being found not guilty by the High Court in Colombo. And we'll see you on the other side of the break.
News First, Newsline with Faraz Shaukutali.
What will be the fate of the state-owned gas company?
එක පැත්තකින් ලිට්‍රෝ එක විකුණන්න සෙට් වෙනවා. අනිත් පැත්තෙන් ඩිමාන්ඩ් එක අඩු කරගන්න පුපුරනවා ඉතින්.
Contradictions on the gas leaks from within the government.
කළමනාකාරීත්වය මේකට වක් කියන්න ඕනේ. සමාගමට ඕන විදිහටවත් මේ රටක් පාලනය කරන්න බෑ.
මේ හිටපු ගමන් පාත් වෙච්ච එක. අපි කියනවා නම් ඔක්කොම ගෑස් සිලින්ඩර් පිපිරෙන තත්ත්වයේ තියෙන කියලා. මේ පාරේ තියෙන හැම ගේකම ගෑස් සිලින්ඩර් පිපිරෙනවා.
Should the SLFP leave the government?
මේ වන විට රජය ඇතුලේ අපිට ඉන්න අමාරුයි කියන කාරණාව අපි පිළිගන්නවා.
Locally produced onions pile up amid import of onions from overseas. For how many years was the Hambantota port leased to the Chinese?
අපි ගිවිසුමකට ඇවිල්ලා තියෙන අවුරුදු 70ක විකිණීමක් සිදු වුණේ නැහැ.
අගමැතිතුමාට වැරදුන අවුරුදු 70ක් නේ අවුරුදු 99ක.
Where is the ship carrying Chinese fertilizer?
News First, Newsline with Faraz Shaukutali.
And welcome back to Newsline Live. I'm in conversation with Professor Indika Karunathilake, and we've been talking about the latest variant. Now then, this latest variant, what's the volume in numbers? First of all, where's the origin of it? Somebody's asking this again. I know you said South Africa.
Yes. Okay. Yeah. It was detected in a South African laboratory.
Right.
So probably African origin, may not be. Maybe South Africa, may not be. We don't know.
Right.
I think it's believed to be originated in a patient, immunocompromised patient, probably, and a patient is HIV, maybe untreated and maybe unvaccinated also, and the virus might have mutated in that environment. So that's a current belief. So,
okay. So what about the current vaccine? Is it suitable to fight the latest variant?
Yeah, I think it's too early to answer that question.
Oh, really?
Yeah.
Oh, my goodness.
One thing is, now if you take the situation where this vaccine has originated, the African situation, that is the geographical area or the continent where the vaccination is the minimum.
Yes, it's about 2%.
Yeah. So probably.
Or 2% in the first dose.
Exactly. I mean, this also highlight the need for the vaccine equity.
And the other thing, of course, is to highlight that here in Sri Lanka, let's say it the way it is. In Sri Lanka, we've actually gone from the first to the second, and we are now at the third stage, the booster stage. And some of these countries in Africa, we must feel desperately sorry for them, and we must pray that their governments and the world at large will come together and make sure that the African continent too get a rapid sort of service in terms of the vaccine being available. Because isn't it true that if the entire world the whole world hasn't got at least 50%, the chances of controlling this pandemic is not very good?
Very correct. I mean, the saying is that unless everyone is safe, no one is safe. So, I mean, we had to go by that. Sri Lanka is actually lucky in that way.
And do we have any statistics as to how many people, how many cases of the new variant are there?
At the moment, the statistics are emerging basically because it started only a few weeks ago. So the patients have been reported in South Africa, but and in the African continent, but the countries outside Africa also. For example, Hong Kong, and patients are reported in Australia, and there were patients reported in Netherlands from a flight that came from South Africa.
Okay.
So in the European countries.
Do we have a tally of how many people have died from this around the world?
At the moment, to my knowledge, no report so far.
Right.
It's too early to predict on this because I mean when you think about the impact of the mutation of this new variant, there are three areas that we need to focus on. One is how fast the spread. Secondly, the severity of the disease. Thirdly, the impact on the vaccination. The first question, there is some evidence emerging that it is spreading fast because the evidence from South Africa that during the last 2 weeks the spread, the rate of the spread was faster than it was observed previously. So there is some anecdotal evidence to say that the spread is fast.
Somebody is asking the statistics of Sri Lanka. What's the percentage of people who even have one dose yet in Sri Lanka?
Very high percentage actually,
Over 50, 60%, 70%?
More than that. Okay. If you take one dose, I suppose around 70%.
Right. Yeah. And the second dose?
Both doses, if you take both doses, over 60%.
Right. Yeah. So internationally, we're doing okay?
We are doing very well actually.
Okay.
We are doing
so
very
then back to this business about the new variant. So as far as you know, not many dead, or not any dead. And the question is this then: will it help us not getting this new variant or any variant if we closed our borders to incoming and outgoing traffic?
Yes, as I have mentioned previously, this particular variant has originated in the contexts and conditions in Africa. So that's why the variants, there were several mutations that has happened. So the variants depend on the environment that the virus faces. So if Sri Lanka can maintain a tight border control, probably we can control or minimize this coming into Sri Lanka. So that's possible. But having said that, as I mentioned, RNA viruses by nature they mutate.
So we may not get that one if we shut ourselves in, but we might get some other variant.
It's possible. It's possible because by nature they are tendency to mutate in RNA viruses. But having said that, the good news is the answer remains the same. Whatever the variant is, what we need to do remains the same.
Right.
The basic mobility restriction, adherence to the health measures, and the vaccination.
And this is a message we've been carrying, and we've been being told by the health authorities here and internationally that it's the same message.
It's the same message.
It's three things that matter the most.
Exactly. In addition to that, I mean, based on our experience in 247 services, if you get symptoms, get tested. And if you are positive, get medical advice.
Is it some people taking antibiotics and so on and so forth? Are these really a waste of time?
Not only waste of time, actually, it can be damaging also. I mean, we have seen that over and over again. Again, if we get back to our services conducted by the Medical Association and the Center, the Center for COVID Prevention, National Center, so far about more than 100,000 patients we have observed. And there are a lot of stories where the patients are taking antibiotics on their own or based on the advices from the health workers and others. It can be quite dangerous and unnecessary because one thing is that it's a virus disease. So at the early stage, you don't need antibiotics. There's no need at all because antibiotics are for the bacteria. And in addition, it can be harmful also because then it might lead to antibiotic resistance. So when you really need the antibiotic, you might not.
And several people asking, how long will the booster last?
That I suppose, I don't think there is data available because the booster has just started.
Is that almost like asking you how long a piece of string is?
Exactly. I mean, there's no real data available on that. I mean, it could be anybody's guess actually.
Do you think Sumanadasa might be able to tell us, the astrologers?
Maybe, perhaps, yeah.
Right. Okay. There you go. We've asked these questions here. But honestly, there are several questions here doubting whether the figures that you've just told us about way over, for booster ones over 70%, both doses around over 50%. Apparently, from the messages I'm getting, this is not accurate. Are you able to tell me whether you've audited these things?
Yeah. Because there is a very organized system where the data are entered into electronic system. Actually, if you have got your vaccine, you can get your vaccine certificate. The electronic certificate you can get by logging into the epidemiology unit website. There is a particular web address, and by logging into that site, you can actually get your vaccine card. So unless the data are accurate, you will not be able to do that. I mean, Sri Lanka over decades has the health system is very strong. That is there.
It is working.
It's working. It's working. I mean, I don't think we should be having any doubt about the numbers that have been vaccinated.
Right. Yeah. Finally, Professor Indika, can you tell us really what should we be doing in terms of the vaccination? There are still people who are doubting the need to take vaccines. Then there are people sort of waiting and not entirely sure about when to take the booster and so on. But can you explain that very clearly to us? And you've got about 3 minutes to do that.
Yeah. One thing is, again, we need to encourage those who haven't got the vaccine. And again, the special focus should be on those who are elderly and then with having comorbidities. Then the second should be the others who are having other diseases, because based on our observations, it's those with the comorbid conditions who are at the risk. Actually, if you take the majority of the patients who get this disease, over 80%, they can basically recover without any problem if they get adequate rest, good nutrition, good hydration, good ventilation, and stay at home. 80% recover without any problem.
Right.
So we have to save those who are at risk.
So we have to save them.
Yes. So the focus should be with those who are having the at-risk conditions, because vaccine works. There's no doubt about that.
There's no two words about that. Okay. And everyone's thanking you for all the information that you're giving us. And finally, what about public transport? Someone's asking us about that. You know, the buses are full, and and you can't really expect the police to start doing all that as well. Surely the people must react.
I would say that's our actually standard, actually. I mean, whatever precautions you take, I mean, if the people have to go for work, then, I mean, they have to get into the buses, the majority of the people. And that means the crowded conditions, the exact conditions that would lead to the spread. So, I mean, that would need massive changes in the public transport and even the working environment, working system. So, I mean, if you are ready to go for that, I think it's possible, definitely it's possible. Moving into the new normal, that's what we say. I mean, changing the working patterns, working hours.
And you just, however late and inconvenient it gets, you might as well wait for the next bus instead of getting into a crowded bus.
Probably, but at the same time, and we have to look at the realities in Sri Lanka also. There's no guarantee that the next incoming bus would be, I mean...
would come.
Yeah, I mean, that is where the rules and regulations should come into play. That's where the government should take the matter very seriously and have rules and regulations to make sure that the public transport is for the benefit of the general public.
Not to make commissions.
Exactly.
And so on.
Yeah.
Right. Well, wherever we go, we can never rid ourselves of this corruption. Well, I'll take this last question. There are many people who have got side effects after taking the vaccine. I too had a headache for almost more than a month after taking the second dose of the vaccine. What can you do?
Yeah. Mostly it's mild. Mostly the side effects are mild and it goes off after a few days. But if you have anything, any effects that last for several weeks, definitely you need to seek medical advice. But generally it's mild.
Thank you. Professor Indika Karunathilake, we really do appreciate your presence on Newsline. Thank you. And that's the way it was on Newsline Live this evening. Take care. And as always, have a great evening and, of course, God bless you.